Pore vacuums, Neosporin on wounds, Aztec cling mixed with apple cider vinegar, skin tag removal creams. These are products that dermatologist nightmares are made of. And millions of people use these regularly. And after 16 years of treating patients, I have seen the damage they can cause firsthand. I am not here to scare you. I am here to give you the clinical reasoning behind my list so you understand exactly why and so you have something better to reach for instead. In the time that I've been treating patients for 16 years, I have seen the same product-related problems walk through my door over and over again, and most of them were entirely preventable. These are skincare products that I would never recommend even to my worst enemy. If you're new here, I'd love to have you. Please hit subscribe so you don't miss what's coming. Now let's get into it. 1. Suction devices and pore vacuums. These Blackhead suction tools have gone viral more times than I can count. The mechanism sounds logical: vacuum out the clog. The problem is the physics. So the level of suction that's required to actually extract anything from your pores is strong enough to cause damage like broken capillaries, bruising, and post-inflammatory hyperpigmentation. And that hyperpigmentation risk is significantly higher in medium and deeper skin tones. Repeated use around the nose can create permanent spider veins that are genuinely difficult to treat, and I have seen it. The satisfying feeling of something being sucked out of your pore is not worth the spider veins, I promise. The better path, I recommend chemical exfoliation with BHA like salicylic acid to dissolve the debris inside the pore, professional extractions done by someone trained to do them safely, or pore melting strips like the ones from Personal Day. A lot of K-beauty brands use these types of melting strips as well. I would leave the suction device on the shelf. 2. Eyelash serums with prostaglandin analogs. I want to be nuanced here because this category has genuinely evolved and my recommendation has evolved with it. The prostaglandin analogs like bimatoprost, which you can find in Latisse, and latanoprost are originally found in glaucoma medications, and they were discovered to grow lashes as a side effect of the eye drops used at therapeutic doses. In eyelash serums, they're used at lower concentrations, but the documented side effects are real and worth knowing. I would say the most common side effect I see is irritation and redness around the eye from using the eyelash serum. And as a result, some people can also get post-inflammatory hyperpigmentation. And some people can just go straight from normal skin to hyperpigmentation from using this. Another side effect that I see, not as common, is what is called periorbital fat loss. Essentially, it's melting some of the fat away, which some people like, but in some people, it can make your eyes potentially look more sunken in. These side effects obviously don't happen in everyone, but these are still notable to talk about. And then there's a side effect that's super rare. I don't think I've ever seen it in somebody who's used a prostaglandin analog eyelash serum, but it has been seen with glaucoma drugs, and that is pigmentary change in your iris, which is the colored part of your eye. The concerning thing about the side effect is that if it does happen, it's permanent. If it does happen, it's usually more common in like green or hazel eyes, and people end up getting like a brown speck in their eye. Now, I used to recommend these eyelash serums because for a long time, they were the only options with real efficacy, but that has changed. There are now lash serums that grow lashes through different mechanisms, and they are mostly peptide-based without the prostaglandin risks. And those are what I recommend now. I will link my current favorites in the description box below. 3. Neosporin. So this one genuinely surprises people, and I understand why. So we know that Neosporin has been around for generations. It is an effective triple antibiotic ointment, but here's the clinical reality. So Neosporin, like I said, is a triple antibiotic ointment. It contains neomycin, polymyxin B, and bacitracin. Neomycin is one of the most common contact allergens in all of dermatology. We see Neosporin contact dermatitis regularly in our practice. Someone applies it to a small wound, and within days, they have a full allergic reaction spreading beyond the wound site. And it freaks people out because it almost looks like a really bad infection. The skin is red, swollen, but a telltale sign is that it's very itchy too. And in most cases, it looks way worse than the original wound. Interestingly, one of the other antibiotic ingredients, bacitracin, does have a meaningful allergy track record as well. So the frustrating part is that plain petroleum jelly, like Vaseline, does the same job just as effectively. Moist wound healing is what promotes healing and minimizes scarring and infections, and plain petrolatum delivers that without any allergy risk. Aquaphor works too. So neither of them contain antibiotics that your skin can react to. Vaseline is older than most of us. It costs $2 and outperforms Neosporin for wound care. The dermatology community has known this for years. 4. Harsh physical scrubs. St. Ives apricot scrub, walnut scrubs, sugar scrubs with large irregular particles. This entire category has a fundamental design flaw. The particles are jagged and irregular, which means that they create micro tears in the skin barrier rather than gently buffing the surface. Those micro tears can cause inflammation, they can accelerate barrier breakdown, and they can worsen acne in people who are already prone to it. The apricot kernel specifically has a shape under a microscope that is genuinely damaging to the skin, and there have actually been lawsuits about this, and the data is not on St. Ives' side. The right way to exfoliate, I recommend using a chemical exfoliant, whether it's an AHA like glycolic acid or lactic acid for dry skin, or BHA like salicylic acid for oily or acne-prone skin. Or if you genuinely prefer physical exfoliation, I would choose a product with smooth, spherical, uniform particles like jojoba beads. The shape of the particle is really what matters, not just whether it's natural. 5. Pore strips. So pore strips are a masterclass in something that looks and feels like progress without actually solving anything. So this is what they do. They temporarily remove the very top layer of sebum and debris from your pores. And what they don't do, well, they don't address the reason the pores are filling up in the first place. Within a day or two, your pores will look the same. And meanwhile, the adhesive on the pore strips can disrupt your skin barrier. They can cause irritation, dryness, and on sensitive skin or around the nose, they could potentially break capillaries. If blackheads and enlarged pores are a genuine concern, the sustainable solution is a BHA serum used consistently, niacinamide to minimize pore appearance over time, and retinoids for long-term pore tightening. These solutions are less satisfying to watch, but they actually work. And I mentioned earlier that there are those pore melting strips, which are much more gentle on the skin. 6. Over-the-counter skin tag removal creams. This is one I feel most strongly about because I've seen serious harm from it in my own practice. And the case that I posted about on TikTok in 2021 went viral because people could not believe what they were seeing. A patient came in to me after using an over-the-counter skin tag removal cream on his cheek. The product had caused a deep chemical burn. The skin was essentially corroded through. This image is graphic and the recovery was painful and lengthy. The most dangerous products in this category contain corrosive botanicals like bloodroot. I mean, that already sounds bad. But yeah, this causes tissue necrosis. These are sometimes marketed as natural or herbal, which makes them seem safe, but they are not. And other products use things like zinc chloride or high concentration salicylic acid compounds that can cause severe burns when applied to the wrong tissue or left on too long. Now, beyond the burn risk, there is a diagnostic risk. What you are assuming is a skin tag may not even be a skin tag. There are things like seborrheic keratoses, dermatofibromas, and in rare cases, early skin cancers that can be misdiagnosed as skin tags. So burning something off at home without a proper diagnosis is not just risky, it can delay the identification of something that can actually need evaluation and proper treatment. In the office, a simple skin tag removal takes literally 30 seconds with the right tools, and it causes minimal discomfort and leaves no meaningful scarring. Please don't attempt to do this at home. Home derma rolling on the face. I want to be specific here because I do recommend derma stamping, just not in this context. Home derma rollers on the face, particularly anything above 0.3 millimeter needle depth. Incorrect rolling technique can drag needles at an angle rather than penetrating vertically, which tears rather than channels the skin. And rollers that aren't properly sterilized between uses can introduce bacteria directly past the skin barrier, and that's scary. Aggressive pressure or overlapping passes can cause scarring and post-inflammatory hyperpigmentation, especially in medium and deeper skin tones. I do recommend like 0.5 millimeter derma stamping on the scalp for hair loss support. This is different anatomy up here, it's a different application, and the stamp mechanism is safer, I would say, than rolling because it goes straight in and straight out. But on the face, microneedling belongs, I would say, in a professional setting where the depth is controlled, the equipment is sterile, and somebody who understands your skin is making decisions in real time. Aztec clay mask mixed with apple cider vinegar. The Aztec clay mask itself, bentonite clay used correctly, I think is genuinely fine. It's a classic detoxifying mask with a real track record. Now the problem is the instructions that are on the packaging, which tell you to mix it with apple cider vinegar. Apple cider vinegar has a pH of around 2 to 3 that is strongly acidic, similar to the pH range used in professional chemical peels. So when you apply it directly to your face, particularly combined with the abrasive texture of the clay, it can cause significant irritation and in some cases, genuine chemical burns. There is documented case literature of apple cider vinegar burns on the skin, and I have seen the aftermath in my practice. The fix is simple. Just mix your Aztec clay with water instead. You get the same drawing and detoxifying effects from the clay, the same satisfying texture, and none of the acid burn risk. Just use water. It says water right there on the label as an option, and somehow the internet decided apple cider vinegar was better. It's not. Your skin does not need to be an experiment. It doesn't need the viral product or the DIY hack or the thing that looked satisfying in a 15-second video. It needs the right products used correctly and consistently. And sometimes that means knowing what to put down. I hope this saves at least one person from a reaction or a burn or an unnecessary office visit. Please share this with somebody you know who is using any of these. It might genuinely help them. All my recommendations are linked below. And yes, a like does help this reach more people. And if you haven't subscribed yet, this is what I do here. Thank you so much for watching, and I will see you in the next one.